Hello everyone, and welcome to the Productive Aging and Work, a framework for developing age-friendly workplaces webinar. We're glad to have you with us here today. This webinar is part of our Return to Work, Stay at Work series that we have ongoing. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Grants Program through the BC government, as well as through donations and memberships to our organization. As I mentioned, I'm Tanya, and I'll be moderating this session and handling the Q&A. And our speakers today are Julianne Scholl, James Grosh, and Berman Ortiz. Julianne is one of the co-directors of the National Center for Productive Aging and Work, or NCPA, as I'm going to use for the rest of the introductions. In addition to directing NCPA, Dr. Scholl conducts translation research with emphasis on the reduction of musculoskeletal disorders among construction workers of different age groups. She also examines workplace intergenerational tensions and does survey research in assessing stakeholder satisfaction and impact. Dr. Grosh is also the other co-director of NCPA, and he's been with NIOSH for over 20 years, and his work focuses on better understanding how behavioral and work organization factors affect a worker's safety and health. Some of his recent projects include changes in health and cognitive ability that workers experience as they age, characteristics of age-friendly workplaces, job stressors associated with the increased risk of heart disease and depression, and the impact of job transitions on both physical and mental health outcomes. And then our final speaker today is Berman Ortiz. He's a public health advisor for NCPA. Mr. Ortiz has expertise in public health challenges affecting Spanish-speaking immigrant communities and in developing culturally tailored public health messages related to both the occupational safety and health of aging workers and public health preparedness and response. Thank you very much to all three of you for being with us today, and I will hand it over to you.
Okay, thank you very much, Tanya. This is Jim Grosh, and the three of us are delighted to be doing this webinar. And what we're going to be trying to do for you today is just talk about the aging workforce. And obviously that's an issue in Canada as it is in the United States and many other countries. And we're going to be talking about the concept of productive aging, and then talking also about interventions, best practices, things like that, for encouraging productive aging in the workforce. So we have a pretty full hour, and we hope to kind of cover a number of different topics. We'll be changing speakers. I'm going to be going first, and then Berman, and then Julianne. So you'll have a variety of different speakers. We also have a video for about 3 minutes talking about a case study at BMW that I think you'll find interesting. So let's get started. This is just a disclaimer slide saying that what we're talking about today does not necessarily reflect the views of our institute, which is the National Institute for Occupational Safety and Health, or NIOSH, in the U.S. Okay, just a very quick overview to give you a sense of the topics we'll be covering. Berman's going to start out by talking about the aging demographics in both U.S., Canada, and other countries. I'll be talking a little bit about some of the occupational safety and health outcomes that change with age. So given that we are going through an aging period in both the population and workforce, what can we expect in terms of safety and health issues? I'll say something about our center here in Cincinnati, Ohio, the Center for Productive Aging, and then Berman will talk a little bit about what we mean by productive aging. And finally, Julianne will talk about some strategies and also case study tools and resources. And finally, and we're looking forward to this, having a little bit of a discussion and some questions. So we're going to have throughout the presentation some poll questions. And let me turn things over to Berman, and he's going to be talking again about the demographics. And he's got a question for you to answer. And I think Tanya's going to put that up right now.
Okay, the question is, at what age do you become an older worker? You can select one of the options: 40 plus, 55 plus, 65 plus, when physical and cognitive abilities start to decline, and it depends on the occupation. So About 8% said 40 plus, about 40% of respondents said 55 plus, 13% said 65 plus, 18% said when physical and cognitive abilities start to decline, and 23% said it depends on the occupation, so the highest being 40%. All right, back to you, Berman.
Yes, thank you, Tanya. Hello again, my name is Berman Ortiz, and as Kim mentioned, I'm going to give a brief overview of aging demographics here in the U.S. and try to give a little bit of comparison with the, some of the data that the Canadian government provides. So we'd like to start with that question of what is an older worker, because that's one of the first questions we get asked. You know, what stage is the cutoff, or what should be considered an older person? And the question, there's different answers to the question. Some of the answers are normative, some are administrative, and depending on what category or what domain you're in, you're going to get different questions. For example, here in the U.S., the Age Discrimination and Employment Act establishes that you cannot discriminate for people who are 40 years and older. And another perspective is a European perspective, which is 45 years and older, and that might be related to in Europe, the people tend to retire a little bit earlier than here in the U.S. And another answer is 55 years or older by the WARP. The U.S. Census classifies older individuals as 55 years and older. And in terms of eligibility for social programs, we have in the U.S. you have Medicare. And in comparison to Canada, the age cutoff is 65 years and older. And another perspective is it depends on generation. Some people might be baby boomers born who are between 52 and 7 years older. And another answer is that it depends on occupational industry. People in different occupations who have different demands on the body or may reflect an older age that what the chronological age indicates. So it's a very suggestive answer, what is considered an older worker. So next, I wanted to talk about a general overview of the changing of the U.S. population. As you can see, from 1900 and projection to 2050, people are getting older. As you can see here, the 45 to 65 year part of this chart, you can see in the continuum is getting bigger. And in terms of and the number of younger workers, and the number of no younger workers, younger people is getting smaller relatively to the number of older individuals in the U.S. And in terms of and in Canada, you can see that. You can see this figure that shows the growth in percentage of age groups in Canada between 2006 and 2011. Overall, the population growth rate for Canada was 4.9%, and of all age groups, the age group from 60 to 65 years older experienced the fastest increase at 29.1%, as you can see here. As in the U.S., this suggests that the aging will accelerate in Canada in the coming years, as the baby boom generation, those born between 1946 and 65 reach 65 years and older. And next, you can see another example of how older population in Canada is growing. And actually, by 2016, it's estimated that the proportion of people 65 years and older is going to be slightly more than the proportion of children 0 to 14. As you can see, this is another example of the growing demographic change we're observing in the population. And to put it in the greatest context, we can see how Canada and the United States compared to other countries in terms of the older and younger population. The United States is slightly younger than Canada, and it's projected to be a little bit older in the projection of 2050. And in terms of terms of the workforce, here we can observe the growing number of workers in the U.S. Labor force. As you can see here at the top part of the graph, the people 65 years plus, you can see a considerable difference in the size of the brackets. So from 2010 to projected to 2014, there's going to be a doubling of people 65 years and older. And yeah, so by 2024, 25% of the U.S. workers will be age 55 years, and 8% will be age 65 years and older. And in terms of labor force participation, you can see that age group of 65 to 74 is gradually growing, similar to the increasing number of people 55 years and older in the labor force. And in terms of the breakdown in industries, we can see that there's a significant percentage of people workers 55 years and older in different sectors in the U.S. with a mean average of 22.6%. So we have agriculture, transportation, and it seems to be the two industries with a greater percentage. And with that overview of different demographics of workers and U.S. population, I'm going to pass it out to Jim, who's going to talk more about the health and the safety and health outcomes of older workers.
Thank you, Berman. We have another poll question that deals with what some of the changes may be as people get older in terms of work-related outcomes. And Tanya, if you could put that question up on the screen for us.
Absolutely. All right, the question is, in your experience, which of the following statements is most likely to be true? Older workers aren't as creative as younger workers. There is little relationship between age and job performance. Older workers are more likely to be absent than younger workers. Younger workers are more likely to be involved in non-fatal injuries. Let's see, we have 7% who say older workers aren't as creative as younger workers. 61% say there is little relationship between age and job performance. 7% for older workers are more likely to be absent, and 26% for younger workers are more likely to be in non-fatal injuries.
Okay, great. Thanks a lot. I think that's really interesting. I mean, people's experience with workers as they're getting older varies obviously by industry and by situation. And what I'd like to do in this part of our presentation is just to give you a sense of what research kind of tells us in different ways of thinking about aging. And these responses give us a good idea. The two in that list that actually seem to have pretty good support in the research is B, which I think 61% of people said, which is that there's little relationship with performance and age. And then D, which I think 26% of people selected, which is that younger workers have more non-fatal injuries. And of course, there are exceptions to that, so you know, things can vary quite a bit. So let me just begin with talking about two different kind of perspectives on aging that I think you hear about quite a bit. They're captured by this quote I've always liked by Benjamin Franklin: all would live long, but none would grow old. And I think that's capturing some of the ambivalence of aging, where there are some things that we look forward to, but things that maybe are less positive about the aging process. And indeed, you can think of aging as a process of decline and loss. There's evidence for that, and we'll touch on that in just a second. But you can also think of aging, either in yourself and others, or others, as a process of development and growth. And there's evidence for both perspectives. So in terms of aging as decline and loss, we know, and this is true from medical research and laboratory studies, that almost all types of biological functioning decline with age. So our bodies wear out, cells wear out, neurons in the brain over time very gradually can wear out. And that has implications, obviously, for safety, slips, trips, and falls, for instance, become more of a concern, and health declines, as we'll see in a second. Also, the risk of disability and chronic health conditions increase with age. That's pretty clear in epidemiological research. Also, recovery following a health problem can be more challenging with age. So these are some of the things that support the idea of aging as decline and loss. However, fortunately, there are some caveats. One is that there's enormous individual differences. So some people decline a little bit, some people decline a lot. And the issue of why that occurs, why there are individual differences, is a very interesting one. There are probably genetic factors, but there undoubtedly are environmental factors as well. And some of them could be related to the work that people are engaged in. Also, it's important to keep in mind that all because that there's a decline in functioning, or maybe you can't lift as much, you can't run as fast, those kinds of changes may not necessarily affect work-related activities. So it may not really matter in terms of how well you can do your job, the fact that some of these changes occur, and a lot of them are very gradual. So that's aging as decline and loss. This is looking at it from the other perspective as development growth, and there's evidence for this too. For instance, we know that crystallized intelligence, which is kind of your accumulated experience and wisdom doing something, tends to increase with age and may counterbalance some of the losses and declines that occur physically. So there is this other factor about getting older that may actually be a positive one. We also know that emotional health tends to be stable across the working life and may actually improve. So things like life satisfaction, for instance, tend to be very stable, and again, there's some evidence it can actually get better. Motivation and perspective may gradually shift and improve as one gets older. And there's some really interesting work out of Stanford. Linda Karsten has done this, where she looks at people's time horizon. And she's demonstrated that as people get toward the end of their lives, their perspective on what really matters in life changes. And in many cases, people become a little bit less focused on themselves and more focused on others around them, although there are going to be differences, of course, individual differences. And I think that sort of time horizon finding probably has a great application to the workplace as well. As you get toward the end of your career, or even the middle of your career, your perspective, your values, your goals may also go through a transformation. And in many cases, that may be a positive one for the organization. Again, there are caveats. Amount of growth may depend on your environment. Some environments may be better to help people kind of grow or develop better as they get older. Also, this kind of age as development and growth requires a long-term perspective because it's gradual. Things occur gradually over time. So given those two perspectives, it's interesting to look at how it plays out in the workplace, because you have things that are getting perhaps a little bit worse, things that may be getting a little bit better. So what does that mean in terms of what we see in workers in terms of safety, health, and well-being? And what I'm going to do now is just go through a few of the outcomes, work-related variables or outcomes, and how they vary with age. So the first one is job performance, and in that poll question we had, that was listed as one. And as a number of you noted, and again, this is across occupations, and it's looking at kind of a breadth of studies, what we find is that the correlation of the relationship is about zero. If anything, it's slightly positive, but if you want to know something about somebody's job performance, or you want to predict that, there are lots of other things that are much better than age. I mean, somebody's training and cognitive abilities and motivation, things like that, predict job performance. But age by itself is actually a pretty poor one, research would suggest. Job satisfaction and job commitment. This is one where there's a slight positive relationship with age. And even if you control for income and status and things like that, we still find a slight positive relationship. Work-related accidents and injuries. This is an interesting one because you find evidence for both a positive and negative relationship, and it all depends which kind of injury you're talking about. And these are data from the United States a number of years ago, but you find the same thing today, and I believe you find the same thing in Canada. This is the rate for fatal accidents In this particular year, I think there were about 5,000 of them. And this is an age-related gradient. And you can see how it goes up pretty dramatically once you get to about 55 or 60 or so. So this is obviously a concern where fatal injuries are more likely. However, if we switch and look at non-fatal injuries, what we find is something much different. And in this particular year, I think there were 4 million non-fatal injuries, and this is a rate. Again, this is going to be a rate per 1,000 workers. And as you can see here, it actually declines pretty steadily after that little bump there for 18 to 19-year-olds, and then it goes down. And that's interesting because it's really a different kind of relationship than fatal injuries. And even the non-fatal ones, you can really break that apart too, because we do know that certain types of non-fatals do increase. So slips, trips, and falls is one example, but many others decline. So again, this is a complicated picture about what you might find when it comes to safety in the workplace. Return to work following injury. We know this clearly, and this has been demonstrated in a number of studies, tends to take a little bit longer as you get older. And some of it may be because the injury is more severe in some cases, or it just takes the body a little bit longer to recuperate and get back to normal. Ability to learn new information. This is an interesting one. I think early work tended to suggest that ability declines with age in terms of learning new things. There's kind of interference from previous things you've learned. However, more recent work, I think, has suggested that it all depends about how you do the training and the learning process. And if it is customized, if it is self-paced, older individuals can do quite well when it comes to learning new things. So some of it may depend on how we train people, how they learn things. And clearly we know from lifelong learning sorts of activities that people who are older can learn lots of new things and continue to develop as they get older. Back pain. This is also kind of an interesting one. If you did a survey of workers, and we've done this in the United States, and I know in Canada you have very nice surveys as well, what we find in the U.S. is back pain is pretty steady in terms of its rate across age groups of workers. So I think we find about 1/3 of workers report back pain in the past year at work. So it's about 1/3. It doesn't seem to go up or down that much with age. However, if you were to only look at workers who are engaged in physical activities like lifting and bending a lot, there you would find a positive relationship with age. So it really depends on what you do at work, what your exposure is. It's not just age, but it's the activities that you engage in. And for those people who have a lot of physical demands, you do find that back pain increases with age. Healthcare costs, and this is one, as I'm sure you can guess pretty easily, goes up with age. And one of the reasons are chronic health conditions. It's not the only one. And this is some data from the Health and Retirement Study in the United States. And it just shows the prevalence of various conditions. Most of these or all of these are chronic health conditions. And as you can see, arthritis is almost 50% reported in workers 55 years and older, followed by hypertension, heart condition, diabetes, etc. And if you were to ask what percentage of the workforce has at least one of these conditions, you'd find something approaching 60%. So clearly this is a concern, and it leads to higher costs, and it may result in earlier disability and things like that. So there's the picture. I've just selected a few outcomes, but it gives you a sense of the complexity. So just a very quick summary. Impact of aging is gradual. It doesn't happen all at once, of course, and it's complex. Some things get a little bit better, some things get a little bit worse. These are the things that we've mentioned that are of concern. These are some of the things that are of promise, that are good aspects of getting older. And again, this is selective. I'm probably not covering everything here, but it gives you a sense of some of the issues. So what does all this mean, implications for age-related changes for organizations? One implication is that primary prevention is important. So, we often say in public health we want to prevent the problem from occurring. So that's primary prevention. But as the workforce is getting older, it becomes even more important, because if somebody gets injured, it's more likely to be severe, it's more likely to be fatal. So primary prevention makes even more sense with an aging workforce. the work environment matters. So it's not just age, it's the environment the person's exposed to, what demands they're under, what resources they have in their workplace. So that matters as well. And then finally, an expanded, more holistic view of occupational safety and health is needed. So as more people with chronic conditions and some of these other issues become more dominant, I think it's probably the case in occupational safety and health. We want to take a more expansive view of health issues and ways of addressing those particular health issues. Many years ago, we did this analysis of health and safety needs of older workers, and it was commissioned through the National Research Council. It's a good resource. It gives you an idea of the state of the knowledge a number of years ago, at least. And our Center for Productive Aging is kind of based on some of the ideas in that report and this idea of productive aging, which Berman will be talking about in just a second. And these are some of the goals that we have for our center. We're trying to develop a NIOSH-wide research goals, build and expand upon collaborations with outside partners, including international partners, because of course this issue is an international issue. One area we really need more knowledge about are interventions and best practices, and Julianne will be talking about that in a second. Develop a broad range of useful translational products on the aging workforce that can provide some guidance and suggestions for strategies for productive aging. So that's the background for our center. And again, this idea of productive aging is what we're focusing on. And Berman's going to say a little bit more about that.
So what do we mean by productive aging? Robert Butler, the first director of the U.S. National Institute of Aging and a prominent gerontologist, defines productive aging as an approach that emphasizes the process of after growing older and how individuals can make important contributions to their own lives and their communities and organizations and society as a whole. So basically how this can be summarized is how, as we get older, how can we minimize the losses and maximize the growth. And Robert Butler, when he first coined this term, he was thinking in a more general terms, not necessarily applied to the workforce. Here in the center, as we apply to the workforce, we define productive aging as being supported by four different attributes. The first one is the lifespan perspective, and the lifespan perspective establishes that the aging process is continuous and complex, and is characterized by plasticity. It can go, is characterized by gain and losses. It's multidimensional, contextual. So it doesn't matter. So we're not necessarily concerned with a specific age. The lifespan means that in the lifespan of a worker, what the worker experienced in the work when he was younger matters when he gets older. So looking at the whole lifespan continuum helps us to better understand the different changes that occur with aging, so workers can get in and out of the workforce. So that's what we mean when we say lifespan perspective. Next is a comprehensive and integrated work. What we mean by this is, like, in order to address the different issues that affect aging workers, we have to look at it from a holistic perspective. We cannot only focus on one aspect. And two examples of this is the Total Work at Home program here at NIOSH, and the workability program that my colleague Julianne is going to talk more in depth to. So Total Work at Home is defined as policies, programs, and practices that integral protection for work-related safety and health hazards. So meaning that you have to, for example, ergonomic intervention has to be integrated with wellness programs in order to work in conjunction, in order to have a greater impact in a determinate piece of intervention you wanted to implement in the workplace. And then is the emphasis of outcomes that recognizes working and organizations. As you can see, they can be very similar, but also they can differ, and what is expected from the workers in the organization. As you can see, from the workers' perspective, you have safe work environment, high levels of satisfaction, ability to make contribution to organization, and this is a bi-directional arrow. The one affects the other and vice versa. And from the organization perspective, you have lower turnout and absenteeism, lower healthcare costs. And lastly, we have supportive work culture for multi-generational. And here are different ways here in the U.S. This is that you can define generations. And when facilitating generations, you can try to identify how different generations might work together and try to determine the different issues and the different ways the different generations might work together, and try to get at the issues of those differences. And lastly, I think that's it for me, and I'm going to pass it out for my colleague Julian, who's going to talk more about practical solutions and case studies for implementing aging-friendly solutions in the workplace.
Thank you, Berman. Hi, this is Julianne. And before we begin this section, I'm going to turn it over to Tanya, and she will display the third and final poll question.
Great. All right. Poll is, to what extent does your organization address aging issues in your workplace? Not at all, in reactive or intermittent fashion. In a proactive or systematic fashion, it isn't an issue in my organization. We have 36% that said not at all. We had 34% said in a reactive or intermittent fashion. 16% said in a proactive or systematic fashion, and 14% said it isn't an issue in my organization. And back to you, Julianne.
Okay, thanks, Tanya. All right, well, it's good to know where people stand or where they're coming from, because that will inform how we think about strategies or how to apply these notions about productive aging. So while we've talked about the statistics and the trends and as well as the concepts about what we mean by productive aging and aging friendly, I'd like to move now into what can actually be done. So if we want to put in some interventions or strategies or engage in some best practices that enhance the well-being and safety of our aging workers, or all workers for that matter, what does that mean? What does it look like? Well, as Berman pointed out before, one of the aspects of productive aging is to employ a comprehensive and integrative approach. And so that's what the workability concept or model talks about, and Berman already talked about that. But this idea of workability does come from the Finnish Institute for Occupational Health, and basically that's the idea of the workability is the extent to which people can continue to do the work that they're doing given the right resources and the proper working conditions. And that becomes an issue when we talk about people who are getting older on the job. Because what kind of declines or what kinds of improvements are we seeing among people who are aging? And I want to put a caveat in. There was another aspect we talked about, which is the entire lifespan. And so from NCPAW's perspective, we're talking about all workers. We are all aging, and yes, it's easier to talk about older adults, older workers with the concept of aging, but it's what was said before in terms of enabling workers of all ages to contribute in a productive way and to be safe and to have a positive well-being, because the kinds of habits and the things that you establish early in life are going to have an influence on how you feel and how you work later in life. So anyway, with that caveat, I just want to talk a little bit more about these different levels of the workability model, which is a version of which is displayed in this slide here for strategies. And you have different levels at which you can approach developing an aging-friendly workplace. And let me just briefly go through these different levels. You have the individual or the worker level. And so what does that really mean? Well, workers on the individual level have their own skills, their own knowledge about their jobs. They also have family issues and family life balance that they're dealing with, different levels of stress, also different levels like physical attributes such as their level of hearing, vision, their strength, and flexibility, as well as the health behaviors in which they're engaging in. And so, you know, an employer or different interventions at the worker level can benefit people, like for example, through lifestyle interventions. Let's say campaigns to remind workers to get their eyes checked, or stressing the importance of vision, for example. We've seen that. Investing in training, enabling your workers to build their own individual skills, because that will definitely pay off in the long run as people stay on the job longer. Also doing such things as encouraging sitting and interspersing with standing, you know, avoiding sedentary work, as well as building their institutional knowledge. So you can address the needs of older workers at the individual level. You can also expand out a little bit and look at the actual work environment where a number of individuals are working. So the work environment can include such things as lighting, distractions, noise, infectious agents, the amount of lifting or standing that's required. Are there slippery or tough surfaces that they have to stand on? So in the work environment, you can employ certain interventions or best practices that help address those issues, such as designing ergo-friendly work environments, doing things to manage hazards. Let's say if spills are common, what can you do to help prevent or take care of spills as they occur, as well as managing such things as lighting and noise, especially because those things can affect people more intensely as they age. And if you take a step back further, there are organizational level dimensions with which you can address the needs of older workers, such as, what kind of retirement plan does the organization have? Are there health promotion programs? What do the work schedules look like? So things that people have found that help aging workers at the organizational level is reasonable accommodations, return to work policies or programs that help older workers get back to work, because there are a lot of companies that suffer from the loss of good, knowledgeable workers because of debilitating injuries. Also, such things as employing workplace flexibility. So there are things at the organizational level that can be done to address the needs of older workers. And of course, you have to look at how this factor in with society-level issues, such as retirement laws, age discrimination laws, Social Security. Also community-based things, such as transportation, like busing, or colleges and schools available in the area. So even at the organizational level, are you providing flexible enough schedules where people can take the bus? Or, for example, if there are elder care facilities available, can a 60-year-old employee be able to have the kind of work schedule that allows them to take care of their 85-year-old parent with dementia, for example? Anyway, these are just some quick examples, but it's another thing to be able to see it in action. So what we want to show you is a quick video of a CBS news segment, and actually you can find this on YouTube, but it's a case study of a BMW plant, and they've employed aging-friendly practices. So I am going to switch it over to the video. If you didn't catch it, it was let's see. Let me go to the next slide here. Yeah, the BMW plant was in Germany, but obviously there's implications for, in the U.S. as well. And so this is just a summary of some of the interventions that were caught, and it doesn't include all the interventions. But if you think about it, there were some such as rest breaks and stretching that are on the worker or individual level. Other things such as adjustable work tables took care of the work environment dimension. And then there was job rotation. It wasn't covered in the video, but this is something that did happen at the plant. And so things like job rotation is a policy that can be enacted at the organizational level. So, one thing that we wanted to stress, that even if you make a small change, if it's implemented appropriately and properly in a setting, it can have a huge and possibly long-term impact. So for sake of time here, I don't want to spend too much more time on these slides, but here's another idea of what can be implemented in the workplace. This is just an example of an action exercise. And the workability model that I talked about previously, that was incorporated into an educational intervention that was developed by NIOSH in collaboration with several other partners. And this is an exercise that was developed out of that intervention. So you can see their type of goal depends on the dimension that you want to address, either at the individual, the environment, or the organizational level. So this encourages you to not only state your specific goal about what kind of change or intervention, or a kind of age-related change you want to see, but also, you know, how you expect it to happen and how you can measure it. So this is definitely something that moves beyond just the educational realm. It forces you to take action. So something I didn't do a good job of mentioning before is that project that I just alluded to. That was part of the it was part of the age-friendly workplace project. It was a project designed to engage in a workshop that led to some interventions and some tools such as videos that can be available to organizations that want to create an aging-friendly workplace. So there were some lessons from that pilot project that that we wanted to make mention here. When you're establishing goals, you don't want to make them too large, but you want to make them manageable enough and large enough for them to have an impact. When you're addressing needs, it needs to go beyond the educational curriculum. In other words, what you teach in a training session, educational session, it may not be enough. It needs to be action-based, such as that goal spreadsheet that I showed on the previous slide. One word of caution: it might be difficult to get organizations to commit, especially if they see it as a huge systematic approach. So buy-in might not be easy initially. One thing to keep in mind is there are conflicts that can emerge from the intergenerations, but they can be advantageous, especially when you use those intergenerational interactions to encourage mentorships and coaching type of relationships. And you know, it is tempting to stick with the classroom model and trying to train people how to create aging-friendly workplaces, but keep it in the classroom has a limited reach, especially if your company's dealing with a lot of technological changes or if you're facing economic downturn or a recession. So before we get to the Q&A here, we just wanted to share some additional resources. We have the NCPA homepage at the top, including a link to the Office of Total Worker Health. The project that I talked about a little bit, and maybe we can elaborate on it the rest of the hour, is the Designing the Age-Friendly Workplace. And there's a link there that shows videos and other resources that can help employers and decision makers employ some of the changes that we had talked about. I said that the workability model is based on the Finnish Institute, or FIO, so there's a link there, as well as an e-guide for healthy workplaces for all ages put out by OSHA in the European Union. Okay, so with that, we have some time for question and answer. So Tanya, I guess I'll turn it back to you.
Wonderful. Thank you very much for that presentation. It's very interesting, and I think it provides some good sources for conversation for people with their workplaces, and also some good strategies and ways to continue and further discussion as well. So thank you to all three of you for that. Let's see if everybody who is online would like to go ahead and submit any questions you have related to the presentation. We did get a couple of questions about the PowerPoint, and I will be providing a link for the PowerPoint after the presentation. So I hope to send out the follow-up email early next week, so you'll receive it then. Let's see. At the moment, I don't see any questions related to... Oh, here we go. During the study, to what degree did any employers revise the work schedules of older workers from like full-time versus part-time?
wait, are you talking about a particular study? I guess we don't. We need some clarification on the question.
Oh, gotcha. So they asked during the study, but they might just mean like generally in your experience of working with or studying employers, is revising work schedules one of the what's the word I'm looking for? Interventions that is used.
Oh, yes, and of course I won't be the only one to comment on this, but some researchers have found that as workers get older, they might value more flexible schedules, even sacrificing some days off in order to get more flexibility in their scheduling. So you know, you do see a lot of evidence of that. And Jim or Berman, is there anything else you want to touch on?
Yeah, this is Jim, and I would agree with Julianne. I think that is very, you know, it's a type of workplace flexibility that is becoming more widely used, I think. And you get other types of programs too. I mean, the question was about going from full-time to part-time. There are other programs like phased retirement, for instance, which is going to retirement in gradual steps. And there are different approaches to doing that. And a lot of these programs, I think, in workplace flexibility can be quite effective, but it's also a matter of how they're implemented. And sometimes that's the most difficult thing of all, is how you introduce it, how you get people to be interested in it. And in the video that was played from BMW, one of the things they did, I think, that really helped with implementation was to get the workers' input and ask them what sorts of things might really be attractive to them in terms of workplace sorts of activities. And the changes in that video, a lot of them were ergonomic, although not all of them were, and some of them had to do with, you know, the rotation through various jobs with different physical demands and things like that. But in any case, yes, that is the idea of increased workplace flexibility for both, you know, the worker and also the organization, and it can be kind of a win-win sort of program if it's done correctly, I think.
Yeah, and that's definitely not just the case for people who are approaching retirement, but suppose people at middle age that find themselves in that sandwich generation, you know, folks that are taking care of kids as well as folks who are taking care of their parents who are needing more medical help. So it can occur, the need for that can occur sooner than we might think.
Very good. Let's see. Someone asking, based on your experience, which is the mindset, the way in which senior management approach the issue of elderly workers and related interventions? I'm trying to think if there's a clearer way to ask that question. In your experience, it might be what's a way to influence or affect the mindset of senior management and the approach of elderly workers and related interventions?
Well, my initial reaction is I guess they need to see a strong business case for it. I mean, and based on some of the presentations or at least I've given and people I've talked to and the questions they raise, you know, the questions are what can we do, and is this going to be cost effective? So, you know, as we pointed out, even the changes, if they seem relatively minor, they can have a significant impact. Anyway, that's my 2 cents.
And I think we could go back to that. I don't know if people can see this on the screen, but if we go back to that table that Berman presented, is that on the screen now, Tanya?
Yes, it is.
Okay. And, you know, we had these worker-centered outcomes and organization-centered outcomes. So those are on the right-hand side, the organizational outcomes. So those are the things I think that in general management, upper management would be most concerned about. And these are sorts of things one could target. So, I mean, I think one could focus, for management at least, on those organization-centered outcomes. And this is not a complete list, of course, but it's some of the areas that I think companies tend to be concerned about from a management level. And then those sorts of things, of course, can impact, as Berman was pointing out, some of the worker-centered outcomes. So this is, you know, some of the things one could mention, or how you could present a case is to focus on these sorts of things.
Great. In a related question, someone asking a little more on the demographic side, in the sense that here in BC, British Columbia, we have a large volume of small businesses where cost control issues, lean operations, and minimal systemic processes are in place for employees, and recommendations about establishing aging-friendly interventions in smaller business settings.
Yeah, that's a very good question, especially since, well, I know that in the U.S., smaller businesses have fewer, have less of an access to these issues. Like with some of the barriers, are you talking about like what? I'm trying to get a sense of the barriers that some of these smaller enterprises face that might get in the way of implementing.
Well, I think some of them might be just not having the resources.
Yeah.
So not having, BMW obviously can bring in all kinds of consultants and experts to provide advice. And I think in the U.S. too, that is a challenge. And I know within NIOSH, just in general, we have a very big interest in small businesses because they are sometimes the hardest to reach. And, we do know that as workers get older, they tend to be in more and more forms of non-traditional employment, like working for themselves or working in a small business. And I think it probably takes some creativity as to how those kinds of situations can be approached from an age-friendly environment. But, many parts, at least in the United States, I'm sure in Canada there are things like this too. There are chambers of commerce where they provide information and resources. And one can think about, these different categories, focusing on individual sorts of activities and encouraging in the small business people to do that. The workplace flexibility is the one that may be a little bit more of a challenge because if you have fewer people, you simply have to have people there at certain times. So, going from full-time employment to part-time employment may be a little bit more of a challenge there. And the work environment, I think, is one that probably, like in a large company, might have a lot of different options there too. So I'm rambling a little bit, but I think it is a challenge, and I know in the work we do at NIOSH that is a segment we're concerned with as well.
Yeah, thanks for that. I'm also tempted to just advise people, look at the workability model here, and especially when, I'm skipping all around over the place here, but when you're, understanding your goals, understanding at what dimension would it be easiest for that particular enterprise or business to address a health or safety issue. Is it easier to just maybe do something at the individual level, or is there one type of change that can be implemented, let's say, just in one particular work area? Yeah, I would just encourage going back to a model like this and separating out all these different types of needs into the dimensions and maybe see which ones are probably the most cost-effective in terms of addressing first.
All right, very good. And then there was one more about workplace-specific kind of question, is wondering about examples in healthcare, and this particular person finding that healthcare settings can be more inflexible around these kinds of interventions and shifts in thinking about aging populations.
Well, yeah, the healthcare setting, especially nurses, that's something that is, really important to NIOSH. I think one of the things that we're starting to address or pay attention to are the musculoskeletal injuries, because those are among the most common among nursing staff in particular. Well, not just nursing staff. Those aren't the only people that are important to us, but yeah, from an issue perspective, musculoskeletal problems are things that do definitely need attention. And Jim, you look like you're going to say something.
Well, I think that is healthcare is a very important area, obviously, both in Canada and the United States. And I think that spreadsheet that Julianne put up, work environment organization, again, can provide a way of maybe segmenting it out a little bit. So if one focuses on the worker, I mean, there are ways of encouraging people to, be involved in health promotion programs, to take action if they were developing a chronic disease, something like that. And this is where I think some of these techniques need to be tailored to the actual demands in the work environment. And in NIOSH, for instance, in healthcare, we do a fair amount on things like lifting and developing ergonomic sorts of approaches when it comes to lifting, let's say, patients for nurses and activities like that. And I think that's come along quite a ways, and with an aging workforce in nursing, a lot of those interventions, I think, become more important. And I know with organizational level interventions, I mean, again, not everything may work, and I think this is where we have a need to, kind of develop a list of best practices that hospitals have employed, and we're kind of in the process of doing that now in our center. But you find, there are phased retirement programs. There are many hospitals, I think, that are doing a very good job keeping on nurses as they're getting closer to retirement and trying to make the work a little bit more attractive, maybe in terms of increased flexibility, while also, taking into account the fact that certain things in a hospital have to get done at certain times. I think there are solutions. And I think one thing in the center we're going to be doing is trying to document what those specific actions are in given industries.
Great. One last question. Has the center been conducting a needs assessment or other means to establish a research agenda?
We are in the middle of such a needs assessment. It's going to involve several different phases, not just a literature search out there, as well as inventory of products and research that's already done at NIOSH, but we have just finished some focus group interviews with employers and employees to get a sense of the kinds of needs they have, as well as the kinds of resources they want and how they want to access those resources. So it's not just a inventory of the needs they want addressed, but also communication needs. Do people want to go to a website to get the information? Do they want more technologically savvy things like phone apps, that sort of thing? We're also about to collect some information from key informants. So going up to higher levels, like higher executive level decision makers in organizations, and other experts in the field that have expertise in occupational safety and health. Sometimes we have to talk to decision makers as well in terms of what's feasible and how this stuff can best be disseminated. And Jim, you have anything to add?
Just that I think there's a lot we can learn from our partners in different countries. In Canada would be certainly one of them, and I think there's some in Europe and Asia too. So we are trying to do our needs assessment with a little bit of a focus on the U.S., but also looking at what sorts of things are already going on in other countries.
Yeah, we already have partnerships with the Finnish Institute as well as the European Commission, and we have connections here in Canada, obviously. So yeah, we have much to learn, not only from within the U.S., but from without.
Wonderful. Great. Thank you very much to all three of you for the presentation and for your insight on this topic. I'm looking forward to seeing what else you guys come out with on a research basis, but also, like you were saying, with the tools and the other resources that you'll be producing. That sounds very exciting.